Chairman, with an estimated 15 million Americans on the brink of losing all access to health care, with millions of our country members experiencing enormous insurance price spikes, and communities dreading the looming closure of hospital and physician practices, our Republican colleagues, in lockstep with President Trump, are leading us toward a true health care crisis, a crisis in which we end up with as many Americans denied access to health care as existed before the Affordable Health Care Act was ever adopted. The Affordable Health Care Act that these Republicans tried in this committee and elsewhere over 60 times to repeal. And so now they are repealing it for some Americans and leaving it barely hanging on for others. This crisis is preventable, like so many of the healthcare complications that will result in increased emergency room visits when people are denied health care and forced to wait until the last possible moment to seek help that's more expensive and likely to be less successful. Who are we talking about? Diabetics that are forced to ration or forego insulin. High blood pressure going untreated until someone has a stroke or a heart attack. A cancer diagnosis that is received too late to put a stop to the cancer. This does not have to become the reality of 15 million Americans, but if these Republicans continue to refuse to reach a reasonable negotiation on our future of health care, that's exactly what will happen. And there are already some of the nation's leading experts that have analyzed what will be the true cost of this Republican catastrophe. University of Pennsylvania researchers have told us, and their estimate is that 51,000 American lives will be lost every year as a result of this cutback, this 15 million Americans that are denied access to health care. This does not even include the lives that are lost by the way Trump has slashed research without regard, in a mindless way, without regard to the impact, closing clinical trials of treatments that might save someone from a death from cancer or other dread disease. The investment that has been cut in medical research, just like the investment that has been cut in access to a family physician, is deadly for Americans, 51,000 per year. And so today we gather here as Republicans attempt to cover with a bipartisan gloss on the very partisan, the very deadly action that they have taken this year. Sure, it's fine to approve all of these bipartisan bills that will, in some cases, provide modest relief, in some cases, provide only marginal relief. But it does not go to the core issue of access. It does not go to the core issue of slashing medical research that is so vital to our hope to overcome dread diseases. It does not go to those issues, because Republicans needed those cuts to medical research, to healthcare access, to help pay for Elon Musk and the billionaire class to get even more tax breaks. That was their trade-off. They had a choice to make, and they chose to go with their billionaire backers instead of to go with the millions of Americans who will suffer directly and some of whom will die as a result of their action. For Texans, Medicaid is a lifeline for 3 million children, for 2/3 of nursing home residents, and nearly 1 million adults with complex disabilities. These are the vulnerable individuals that Republicans have abandoned. They were put on the chopping block so a few billionaire donors could store yet another tax break. Under the big, ugly bill, burdensome reporting requirements rushed through in about a year's time will result in fully qualified individuals losing their access to a family physician. Deep funding cuts to safety net hospitals will result in closures and communities losing the only place where someone can receive care. Now Republicans are planning to take away coverage from 1.7 million Texans, almost 2 million, as they eliminate the tax credits, as they take them away from Texas families. This open enrollment for marketplace plans begins in just another 6 weeks, and the notices are going out now about those premium spikes that will discourage some families from even applying. So much is at stake here, so much more than any of the bills being considered today, because we need to protect the health care of our fellow American citizens, and it's not being done in any of the bills that occur today when it comes to access and medical research. I yield back